Well, the B12 issue is a really important one. I'm Dr. John McDougall. I always get asked this question about B12. Well, let me tell you why I get asked, because it's really the only argument anybody can have against the kind of diet that I so strongly recommend. You can't argue that it's protein deficient, amino acid deficient, calcium deficient, or any other deficiencies, but you can't say B12. Well, we deal with that, to avoid the 1 in a million chance of developing a disease caused by B12 deficiency. It's like 1 in a million. You can develop biochemical changes much more frequently, of course, but in terms of real disease, 1 in a million. But we don't want anybody to have any problems following the McDougall diet, and so I've always recommended a B12 supplement. You just need a tiny bit, much, much smaller amounts than you can buy in the health food store or the grocery store. Usually they recommend doses of 500 to 5,000 micrograms. You need about 0.5 micrograms a day at most. Now, we recommend 5 micrograms of B12 a day, but you're still taking in 100, 1,000 times more B12 than you need. Fortunately, I don't think it's toxic, but I could be wrong. I mean, there have been some recent studies on B12 associated with an increased risk of lung cancer. I can't understand why, and so I'm not going to react to it too strongly. But let's just say, like taking any supplement, any medication, there are positive effects and negative effects. But so far, I feel like the positive effects way outweigh the negative effects on taking B12. At the very least, you won't get any criticism about being on the healthiest diet on the planet. So as far as what kind of supplement you should take, I've got a couple of papers. Well, first of all, I started out recommending that you take basically any kind of B12, and there are several forms. There's cobalamin is the basic molecule, cobalamin. There's a methyl, a hydroxy, and a cyanoform of cobalamin. So originally I started out just recommending just any old kind of cobalamin supplement. But the paper came out that said that eating the cyanoform was not particularly good for you. It didn't result in the neurologic benefits that we were looking for. And so I said, okay, well, I'll recommend the methyl and hydroxy form. What paper said this? But anyway, I felt it was worth moving on that and told people to pick the methyl and hydroxy form. And then I got another paper, the second paper. And really, I only have 2 papers that have opposite recommendations. And they say that you really need the cyanoform for the nervous system. And it's really important, and that the methyl hydroxy isn't going to do it. Well, right now, I don't blame you for being confused, because the science is confusing. It's confused because it really hasn't come down to proper studies to determine which is best. So what I've recommended is that when you take B12, that you take a couple of different forms. In our home, we have the methyl, the hydroxy, and the cyanoforms, all 3. And so whenever I think about it, how often do you have to take the B12? Well, I told you 5 micrograms a day is plenty. Well, you can also take it weekly or monthly. I take it when I remember it. And I would guess that's on the every few monthly areas. So what I do is I take all 3 forms. And but you could consume a different form every week. That'd be one way to do it, or you just take all 3 forms at one time. That's to be on the extreme safe side. But again, your risk of B12 deficiency is extremely small. Even if you can't absorb B12, it takes 2 to 3 years to run out of your stores. If you have this deficient circulation where the B12 is utilized over and over again by the gastrointestinal tract, then it takes you 20 to 30 years to run out of B12. So, I wouldn't put a lot of effort into it, but we sincerely do recommend, as I told you, Mary and I take it, that you take a B12 supplement if you're going to be strictly on our program for more than 3 years, or you're pregnant or nursing a baby. That pretty much covers it all. I'm Dr. John McDougall. I hope that helped you understand a little bit of the confusion out there on B12.